So, welcome back everyone. So, this is the kind of the mini mock. In this mock, we will do the two section both. There is professional dilemma questions as well, and also the clinical questions as well. So, the first part we are going to do 23 professional dilemma questions, and the next part we're going to do 43 clinical questions. So, it is kind of the half of the questions you will get in your real exam. So, we try to do it in the 45 minutes both, no break. So, and also in this mock I will give you the answers alongside the questions, but try to skip that and try to solve the complete mock first, and later on come back to the video and check the answers. Okay, so without further ado, we just start our clock ticking and start our mock. Best of luck. Okay, so let's start. Okay, so let's start. You're a foundation FY2 doctor working on the medical ward. You're preparing for your consultant's ward round, which take place this afternoon. Andrew, another FY2 doctor, is working with you and is also expected on the ward round. Andrew tell you that he must leave the hospital in the afternoon to attend the court hearing about a car parking fine, which he failed to pay. But he does not want the consultant to know about this. He asks you to tell the consultant, Dr. Steven, that the reason he cannot attend the ward round is because he is unwell. So, rank the situation appropriately. Okay, moving to the next, you will check the pause the video and read the answers, but after the whole mock. Okay, so question number two. You are foundation to doctor working in the hospital. Mr. Ahmed, 62-year-old man, is waiting the result of the test for the bowel cancer. The ward clerks tell you that seven of his relatives are at his bedside. His eldest son has specially asked that you do not disclose the diagnosis to Mr. Ahmed if it is a cancer, as he feels that his father could not cope. Your consultant calls from the endoscopy suite and advise you that the diagnosis is a sigmoid carcinoma. So rank the situation accordingly. Okay, moving to the next. Okay, the question number three. You are a foundation FY2 doctor at lunch with your FY2 colleague Sarah, who works on another ward in the hospital. During lunch, she is bleeped for the fourth time by the nurse on her ward. When she calls back, you hear her shout down the telephone at one of the nurses. So, rank accordingly. Okay, then moving to the next. Okay, G. So the next one is you are a favorite doctor working in the general practice. You finish a difficult consultation with Mrs. McCarty. She is well known to the doctors and other staff with the frequent appointments. She is refusing to stop smoking despite a severe COPD and is demanding the oxygen at home, which she cannot have due to her smoking. One of the receptionists asks you how it went. So, rank the following action response to the situation. Okay, G. So, moving to the next. 5. You're a foundation doctor working in emergency department. An FY2 colleague, Sarah, asks you to assess a patient for her. Patient is intoxicated with alcohol and was verbally abusive to Sarah when she attempted to assess him. Sarah is very upset about the incident, so rank the options accordingly. Okay, moving to the next. Okay, sixth one. You are a foundation doctor working on the elderly care wound ward. You hear a patient with a dementia crying out for the help. You go to find the senior ward nurse to see if she can help him. The senior ward nurse apologizes and states that she cannot attend to him at present as there are others who are very sick and then all other nurses are also very busy at the present. She also stated that this particular patient, Mr. Quickland, is always crying out in distress due to his dementia. And although it is sad, there is little she can do. So rank the options appropriately. Okay, so moving to the next. 7. You are a foundation FY2 doctor working in the respiratory medicine. Ellen is a fellow FY2 doctor working on the same ward as you. You see him when you are not at work. Ellen tells you that he will refuse to have a seasonal influenza vaccine. So, rank appropriately. Okay, moving to the next, which is 8. You are a foundation doctor working in the adult medicine. It is the first day of your agreed annual leave and you are driving to the airport. Your ward telephones you to ask you, where are you? An FY colleague, Mike, should be covering your shift, but he is not arrived. The ward does not have a Mike's mobile number, and neither do you? So, rank appropriately. Okay, moving to the next. Ninth. You are a foundation doctors in the obstetric working in the internal clinic. You are waiting to talk to a midwife about your current patient. The midwife is assertive, informing another patient of the risk of smoking during the pregnancy. The patient does not appear to be listening to his advice. The midwife turns to you and says, "This woman will not stop smoking." What you have to say to her, doctor? Okay, so rank the options appropriately. Okay, so moving to the next. You refer to doctor working in the emergency department. The waiting time is currently 4 hours for the least seriously ill patient. A middle-aged female patient with a small cut on the hand who has been waiting for 2 hours to be seen stops you as you passes by the waiting room and begins complaining to you about the waiting time. She goes on to say that she needs to collect her daughter from the school. So, rank appropriately. Okay, the next is 11. You are referred to doctor working on a general medical ward. You have been asked to correct a drug error on the drug chart written by your registrar, Dr. Smith. This is the 10th drug chart written by Dr. Smith that you have had to correct this week. So, rank appropriately. Mm. Okay, so next is okay, the next is 12. You are a foundation FY to doctor working in a GP. Mrs. Marshall consults with her 6-year-old son, Chris, neither of whom you have met before. Chris has a diagnosis of acute tonsillitis for which you decide to prescribe treatment. Mrs. Marshall is annoyed that Chris has seen by the ear nose, and throat consultant last month and was advised that he had he had not had significant episode of tonsillitis to the tonsillectomy. She tells you that she had her own tonsils out around the same age and felt much better afterwards. So rank the options appropriately. Okay, so moving to the next. Okay, the next is select the best three. You are a you are a foundation FY2 doctor working in the emergency department. You are in the relative's room with a 50-year-old woman, Mary, who had just told her that you and your team were unable to resuscitate her husband, who were brought in this morning. He had been in the cardiac arrest for 10 minutes before arrival at the ED. She becomes quiet and then suddenly grabs you by the shirt and screams that it is cannot be true. She shouts that it is your fault her husband has died and you should have been able to resuscitate him. So select the best three options. Okay, moving to the next, which is 14. You are F you are FY2 doctor working in the pediatrics. You are just about to leave the hospital after a long day on call when the nurse asks you to take a telephone call from the Sarah Davis. Her 3-year-old son, Ben, has been admitted 3 times in the past month with abdominal pain. Investigations are all been normal. Ben has the same pain again in the evening. When you speak to the Sarah, she wants to know why the doctor have been unable to find out what is wrong with the Ben and she's concerned about his health and she's becoming upset. So, mark the best three. Okay, ji. So, read the answers. Next is 15. You are a foundation doctor working in the gastroenterology outpatient. You review a 30-year-old woman, Helen, who has been seen on 3 occasions with irritable bowel syndrome. Helen starts crying and states that severity of symptoms she experiences has ruined her life. She claims that your consultant, Professor Khan, a very well-respected gastroenterologist, does not care about her, as she said that there are much worse diagnoses and she must try to learn to live with it. Okay, so select the best three. Okay, so answers is this. So move out to the next options. 16. You are working as a foundation doctor on a busy medical ward. Patient Mr. Davis complains to you that registrar has spoken to him in a very brief and a cold manner on the two occasions. You know that registrar is a very kind and gentle manners with the patients. So select the best options. Okay. So the answers is okay. Moving to the next 17. You're working in acute medicine and are covering the coronary care unit. It's your partner's birthday and you have a ticket for the theater. You need to finish promptly to get home in time. Just before the end of the shift, Dr. Orr, who is taking over, calls to say he's stuck in traffic and will be an hour late. So, what are the most three appropriate actions? Mm. Okay, so the answers is okay, moving to the next, which is 18. You are a foundation doctor working in the general surgery. You are coming at to the end of your night shift. Sarah, the FY2 taking over from you, tells that she has just found out that her mother is critically ill after the road traffic accident. Despite this, Sarah has turned up for the work as usual and says she does not wish to have a time off on her record. So, select the best three options. Okay, so the answers is okay, so the next one is 19. You are a medical ward round when the consultant tells your foundation FY2 doctors colleague Emily to perform a plural tab on Mr. Lucas. Emily tells the consultant she is competent to do the procedure. However, Emily tells you a few days ago that this was the procedure she had not yet performed. You have performed this procedure several times. So, select the best three options. Mhm. Okay, so moving to the next, this is answers, which is the last one. Oh no, there are two more. So, 20th. You are a foundation doctor working in emergency department. As part of your training, you are entitled to protect study leaves within which you can arrange time to meet with your education supervisors. You had originally arranged to meet with him last week, but you ultimately canceled your meeting because the consultant asked you to stay in the department at short notice due to the lack of staff. Your meeting has been rearranged for today. As you are about to finish your shift and leave for the meeting, your consultant approaches you to ask if you can stay a little longer as the department is extremely busy. So, select the best three options. Okay, the best answers is AFG, and the rationale is this. Okay, moving to the next one, which is 21. You have been very busy at work recently, as some of your colleagues have been on leave. There are a number of personal issues you are troubling you. You have not been sleeping well. You are aware that you are not performing as well as usual. You often do not complete your duties by the end of your shift. You have been irritable with your colleagues. So, select the best three options. Okay, so our answer is okay. Moving to the next, which is 22. You are a foundation doctor working in the hospital. A patient disagree with your diagnosis and asks to refer to the second opinion. He threatens to take a legal action if you do not comply. So, select best three options. Okay, so the answer is this is rational. And moving to the next one, which is 22. You are a foundation doctors in a surgery. You are looking after Carrie, a 25-year-old patient who was operated by your registrar yesterday. You have just taken post-operative blood from Carrie. When the theatre nurse believes you, she asks you to add a HIV test to this request as your surgical registrar sustained a needle stick while performing the Carrie's operation. So select the best three options. Okay, so the answer is Okay, moving to the next. So we have done almost in 30 minutes, 35 minutes, the 21, which is a half of the time. And then moving to the next is the clinical part, and we just restart the 40 minutes. Okay, nahin. Now we will do the clinical part in 30 minutes. So without further ado, just click start the timer. So the first is a 59-year-old man complaining of sudden onset of severe pain in his left loin associated with visible hematuria. He returned from the holiday in Africa yesterday. Okay, so the answer is C. Next is moving to the other one, which is a 19-year-old man presenting with a weight loss. On examination, he had a left varicocele and visible hematuria. So the options are these and select the best one. So two, it should be F, right? Next is 56-year-old diabetic man has thickening and discoloration of his toenail with itching and flakes, skin bit in the toe, with skin scraping cultured Trichophytum ruberum. So what is the treatment for it? Okay, so the answer is H. Next is 4. A 20-year-old female school teacher complains of 3 days history of intense itching all over her body, particularly at night. Ex- Examination revealed excoriation marks on the skin and rash in the finger web. What is the most appropriate treatment? So answer is G. Yes. A 55-year-old woman who complains that people that she looks tired on examination, she has thinning hair, dry skin, and facial puffiness. So what should be your diagnosis? Okay, so the answer is H. Yes, hypothyroid, right? A 35-year-old man present with tiredness. He explains that his ring is getting much tighter, right? So what should be diagnosis? So answer is G. It is acromegaly, right? So 52-year-old man with a swollen tender Achilles tendon following a course of antibiotics. So you need to find what is the cause of this Achilles tendon. So answer is 7 answer is B. Cipro is causing the tendonitis, right? And 8 is a 19-year-old female who develops a widespread rash following treatment with antibiotics for a sore throat associated with the swollen neck gland and fatigue. Answer is A. Amoxicillin, right? Most likely the is so the answer is A. Next is 20-year-old man who developed pigmentation to his face during the treatment of acne. So what could be the cause for this? So answer is H. Minocycline. Okay. Next is diarrhea. A 2-year-old boy with a 3-day history of vomiting profuse watery diarrhea to most likely were most likely an infection which is occur in 2 years old baby is can we know that it is should be answer number G, rotavirus. Okay, the next is diarrhea is again 3-year-old getting episode of abdominal pain and soiling her underwear with a liquid stool for several weeks. Several weeks. So now it is a several weeks. So answer should be so answer should be 11 is answer is H, no, B. Constipation with overflow diarrhea. Hmm. 38 woman with a breathlessness and intermittent dizziness. Examination revealed a loud ejection murmur radiate to the neck. So what's the diagnosis? So 12 answer should be C. Aortic stenosis, murmur radiate to the neck. The next is 13. Heart murmur is next is 84-year-old woman complaining of the breathlessness and palpitation. She is concerned as she has recently coughed up blood. Examination reveal has an irregular and diastolic murmur at the apex. So, what's the answer? So, answer is E. Mhm. Okay, moving to the next. A 50-year-old male ex-smoker with abdominal pain, which is worse after eating and accompanied by the acidic taste in the mouth. So, what should be the answer? So, answer is C. Yes, good. Next is 15. A 40-year-old overweight alcoholic woman present with the upper abdominal pain, which is worse after eating and radiate her back. So, answer is I. Pancreatitis. Yes. Moving to 16. A 40-year-old woman with episodes of spasmodic upper abdominal pain, which is worse after eating and can keep her awake at night. Okay, so answer should be hmm, yes, gallstone pain, right? Moving to the next, which is 17. A 58-year-old man with a history of hypertension, 1 day history of pain in the right foot. On examination, there is the standard swollen first metatarsal joint. So, what should be the diagnosis? That should be your B. Gout. Yes, thiazide diuretics can cause hyperuricemia, leads to gout. Next is 18. 45-year-old woman present with a stiffened swollen joint affecting her left hand with the pitting of her nails. So answer should be pitting of nails joint. That should be your psoriatic arthropathy. Yes, answer is F. And next is 19. 35-year-old Tyler with a 2 day history of painful swollen right knee. On examination, there is a fluctuant swelling anterior to the patella. So your answer should be A. Yes, bursitis. Next is 20. A 24-year-old woman with a past medical history of recurrent miscarriages and deep venous thrombosis. So, what should be the antibody you should be testing for him, for her? Should be antiphospholipid antibody, yes. Next is 21. A 45-year-old woman, it's jaundice investigation normal. So, what should be the? It should be D, anti-smooth muscles, yes. Antimitochondrial antibody. And next is 22. A 55-year-old accountant who present in the afternoon explained that he has experienced difficulty moving his head well enough to control his computer mouse at the morning. This problem had resolved with the lunch time. F, yes, transient ischemic attack. Next is a 63-year-old man complained that over the past few months she is finding it difficult to turn over in the bed and need help to button up the shirt in the morning. So, mm, the answer is D. Parkinson. Yes. No, patient become bradykinesia. The patient has a bradykinesia. Okay. The next is a 41-year-old woman who has noticed that her hands shake. It happens occasionally about 4 years ago, but now it seems occur almost all the time. She had wondered if she might drinking too much alcohol, but eventually it helps. Her mother has similar problems, so it should be E. Essential tremors. The only tremor help with alcohol is essential. So next is 25. A 72-year-old female with a history of bronchiectasis who present with increasing breathlessness and mucopurulent sputum over a week. On examination of her chest, she has left basal crepitation. Her respiratory is 96, respiratory 15, and temperature is fine. So what is the most appropriate investigation? H, sputum culture, right? Okay, the next is 26. So answer is E. Yes, suspecting pulmonary embolism. Next is a 40-year-old man with erectile dysfunction. He has been a smoker for 20 years and recently stopped. She described a pain in the buttock area when he walks briskly. So, what should be your diagnosis? The answer is G, peripheral vascular disease, right? So, the next is 28. Erectile dysfunctioning, it has been a recent in onset. He describes an episode of numbness in the right leg, which spread his leg 3 months previously, latterly to weeks, and then resolved. He also had an episode of blurred vision last year, resolved few days. He take omeprazole for muff reflex and cetirizine for urticaria. So, what should be the answer? F. Multiple sclerosis, relapsing and remitting disease. Okay, now selecting the single best answers. 53-year-old woman with SLE present with a dull chest pain and gradually increasing shortness of breath. Examination revealed the raised JVP, soft heart sound, and blood pressure of 120, which drops to 100 by 60 on inspiration. So, what is the most appropriate investigation in the case? Echo, right? Mhm. Next is treatment for type 2 diabetes. A 60-year-old woman who has type 2 diabetes for 3 years and has been diet controlled so far. Her BP is 155 by 95. Her blood mass index is the body mass index is 32. Her HbA1c is 70 millimole per mole, and target range is less than 6. So, what is the most appropriate treatment for her? The answer is E, metformin, as she is not been using any kind of medicine before. So, first line is always metformin. So, a 50-year-old man present with a fatigue had a partial gastrectomy 40 years ago. The result of full blood count is there, and the question is select the single most appropriate investigation that is likely to lead to the correct diagnosis from the listed below. So, patient presented with a fatigue. Mm. So, answer should be D. Where it is? Yes, D. As the total gastrectomy leads to the stop of the intrinsic factor leads to stop absorption of the serum vitamin B12, and also there is a MCV is higher and low hemoglobin, the most likely it is anemia, megaloblastic anemia. Okay, the next is a 9-year-old boy present to the ED with a 1 day history of intermittent diarrhea and the central abdominal pain, which is now moving to the right iliac fossa. On examination, he's paraxial guiding in the right iliac fossa. So, what is the most appropriate? So, answer should be B, D. Ultrasound abdominal pelvis. So, the answer should be B. A 72-year-old man is admitted to the emergency department with an hour of sudden onset of right side weakness and speech difficulty. He has no significant past medical history and is no medication. Brain imaging revealed the area of ischemia in the middle cerebral hemisphere. So, most appropriate treatment. Mm. So, as it is just 1 hour, so answer should be A at the place. Next is 34. A 40-year-old male present with a left loin pain, having recently had episode of diarrhea and vomiting. The pain was very severe several hours ago, but have mostly settled now. Examination is remarkable urine analysis or some blood, but no glucose protein or urticaria. So, what is the most appropriate? Select one. So, likely it is stone. So, answer should be CT scan. CT scan is more sensitive for the stone. Next is A 25-year-old man present with a 6 history of itchy discharge left ear. He is not in pain. On examination, he has patch of eczema on the trunk and arms. Examination reveals the moist left external auditory canal tympanic membranes appear normal. So, what is the most appropriate treatment? So the answer is B, topical antibiotic and steroids. Okay. Next is a 52-year-old man present with abrupt onset of acute redness, severe pain and swelling in the first metatarsal pharyngeal joint. So what is the most appropriate options in this? So answer should be your E, NSAID. And the next is 37. A 25-year-old man present with the left scrotal swelling. He stated that he and his partner have been struggling to conceive for the 2 years. The swelling seemed to disappear when he lies down. So the answer should be E, varicocele, right? Okay. Next is lung tumors. A 59-year-old man with a had a pleural biopsy 1 year ago for the pleural thickening and effusion, which was inconclusive. He is now present with a large mass over the entry of the biopsy needle. So answer should be C, mesothelioma, right? 70-year-old woman complains that her eye is acutely watery, painful, and red, and with some blurring of vision. His visual acuity is reduced, blood pupillary reaction is normal. So what should be the answers? So answer should be B. Next is 40. Uh, 30-year-old woman present with a history of menorrhagia. She has completed her family. So, what should be the most appropriate choice of contraceptions for him? So, amenorrhagia with the best treatment is should be D. Yes. Next is 41. A 39-year-old woman present with a 6-month history of amenorrhea. She has schizophrenia. She denies sexual intercourse for the last 2 years and reports some episodes of lactation. FSH and LH normal and prolactin level is very high. So, what should be your diagnosis? Could be A. Yes, schizophrenic antipsychotic medication cause the increased prolactin levels. Next is 42. A 14-year-old boy present with the one history of bilateral nasal congestion, sneezing, and clear bilateral nasal discharge. The family has a recent purchased a cat. So, what should be the most appropriate management option for the boy? The answer should be B. Inhaled corticosteroids. Next is 43. A 64-year-old man with weight loss and painless jaundice. So answer should be your B. Painless jaundice is mostly the cancer. Next is a management of a low back pain. A 20-year-old man presenting 1 day history of right-sided low back. On examination, he has a straight leg raise test 55 on the right and 85 on the left side. With a bilateral negative sciatic stretch test, there is no bony tenderness or neurological sign of note. What is the most appropriate management? I guess it should be self-management advices. Most likely it should be muscle spasm. Okay, so next is 45. Uh, 35-year-old woman present with a worsening difficulty breathing. On examination, she is taking in a single word, talking in single word at time, and appears blue around her lip. Her respiratory rate is 28, saturation is 92, and heart rate is 120 beats per minute. Auscultation of chest revealed widespread wheeze and poor entry in the lung bases. Hmm. So what should be the immediate management? So answer should be D. Yes, salbutamol. It is acute exacerbation. So next is 46. 20-year-old woman has lost 15 kg in weight over the past 2 months. She also with fine tremor and amenorrhea. The answer is B. Grave disease, right? Next is 47. That is pediatric diagnosis. A 6-month-old baby born at term with a normal delivery present with coryza, dry cough, and tachypnea. On examination, she has a temperature of 37, intercostal and subcostal recession. On auscultation, there are mild crepitus throughout both lung fields. So answer should be B, bronchiolitis. And 48, a 64-year-old man have a routine blood pressure check. Pulse rate is 68, and the rate is noted to increase during the inhalation and decrease during the exhalation. So, what is the cause of the irregular pulse from the listed below? So the answer is B, sinus arrhythmias. Okay, so this ends are this. So we just done 48 MCQs in almost 25 minutes. So this is the kind of the questions you will get in the real exams. You have our headings in it and you have the questions like this. So best wishes for your exam.